Hi, I'm Laura Siminoff, Dean of the Temple University College of Public Health. And the great news is that the number of cases in the United States have dropped significantly since January. And now that the weather is warming up, though, people are going to be out and about more. This is obviously good for all of our mental health, but there are concerns that, like in Europe, we'll have a third wave, partly because people will start thinking the pandemic is over. And what we really need to remember is that the number of cases are still extremely high. Indeed, they are much higher than they were when many of us went into lockdown last year. So here to tell us a little bit about where things are headed and how you can protect yourself and your family are faculty experts Graciela Jaschek, Sarah Bass, and Krys Johnson. So I want to start with Graciela. I want to first touch bases with you about something that's been in the news, and that's the AstraZeneca vaccine. There seems to be a lot of confusion about whether it's safe and also what it means for vaccines that are available in the United States. I've heard a number of people compare side effects from AstraZeneca vaccine to side effects with the Moderna and the Pfizer vaccine. So can you fill us in a little bit about this?
Sure. Well, the AstraZeneca vaccine has been approved and used in more than 70 countries, including Canada, Mexico, and India, and several European countries also. The vaccine is not yet authorized in the US, but likely will be by the end of April when the Food and Drug Administration has sufficient safety and efficacy data. Last week, some European and African countries temporarily suspended the use of AstraZeneca's COVID-19 vaccine following reports of blood clots among people who had received the vaccine. Of course, it is a routine requirement to report rare events, but it doesn't necessarily mean that the rare events are in fact caused by the vaccine. In fact, blood clots are not unusual. They are the third most common cardiovascular disease globally. So on March 17th, the World Health Organization stated that the benefits of the AstraZeneca vaccine outweigh its risks and recommended that vaccination continues. On March 18th, the European Medicines Agency reached the same conclusion and stated that, quote, the vaccine is safe and effective and will greatly contribute to address the impact of COVID-19 and the very serious health risks of an infection. Today, March 22nd, AstraZeneca announced that in an interim analysis conducted in the US and 3 other countries, the vaccine showed it reduced symptomatic disease by 79% and hospitalizations by 100%. Additionally, the study showed that the vaccine was not associated with blood clots. So in short, the AstraZeneca vaccine, the world's least expensive and most used vaccine, is considered safe and effective and compares favorably with studies of other vaccines.
Okay, well, that's good to know. The last thing I wanted to ask you about is that, I mentioned that the weather is getting better and there's spring break and people are starting to travel. It's clear that, air traffic is up, and I go out on the highway and I see lots and lots of people around and about. So can you comment on the safety of travel, both for people who are not vaccinated and for people who are vaccinated?
Sure. So in a statement updated on February 16th, the Centers for Disease Control and Prevention restated that travel increases the probability of spreading and getting COVID-19. So it is better not to travel, but if you must, you need to take precautions to protect yourself and others from COVID-19, even when you are fully vaccinated. The precautions include the same as usual: wearing a mask, social distancing, washing or sanitizing your hands frequently. So before traveling, make sure that you're aware of all the testing requirements, both before and after travel, and also any travel restrictions, such as stay at home and quarantine requirements. If you drive across several states, you need to adhere to local and state restrictions, such as quarantines, mask regulations, curfews, and dining restrictions. So remember that many types of travel require long periods of time in public spaces, such as terminals, security lines, a crowded plane or bus, going into stores to buy food or gas, or simply making bathroom stops. All of these activities put you and your traveling companions at risk of getting exposed to the virus and contributing to the spread. So before you plan the trip, vaccinated or not, weigh carefully the risks of travel.
It's a very good suggestion. And I actually saw recently that the American Automobile Association has a map now where you can plan your route and it'll show you what the restrictions are as you go. We'll put that link up on our website for people. Krys, about 12% of the US population is now fully vaccinated. Does this mean, again, people are very confused. Does this mean these people can't get COVID at all? Can they infect other people with COVID? And again, what are the guidelines for people who are fully vaccinated? So any of them in any order you want.
I'll handle them one at a time and in that
Okay.
order. So thanks, Laura. Early estimates show that between 10 and 15% of fully vaccinated people can still become infected with COVID-19. You might have heard these called breakthrough cases in recent media articles, and that's normal. People who get the flu vaccine still get the flu all the time. The important thing is that 95% of the folks who are fully vaccinated and become infected with COVID-19 remain asymptomatic, and 0% of them become severely ill or die. And that 0% is across all of the vaccines that we talked about, even the AstraZeneca that Graciela just spoke about. Now, we're not sure yet if a fully vaccinated person can spread the disease, but one study found that fully vaccinated people who were positive for COVID-19 only produced about 1/4 the amount of viral particles which allows the virus to spread from one person to another compared to unvaccinated infected people. So that means at the very least, we reduce the likelihood of transmission by about 75%, which is excellent considering that we have these new variants that are more infectious overall. So for fully vaccinated folks, that said, I mean, if you're fully vaccinated, you can now visit with other fully vaccinated people without wearing masks or physical distancing. So a lot of grandparents are going to be able to meet grandkids and things like that. They can also visit with unvaccinated people from a single household who are at low risk for COVID-19 disease. They can do that indoors without wearing masks or without physical distancing. Again, though, that's only a single household. That's not a multi-family event like a holiday or wedding or whatnot. And to that point, fully vaccinated folks should still wear a mask whenever they go out, still keep 6 feet from others, and avoid medium and large-sized in-person gatherings. I, along with millions of other people, had to either downsize weddings or put them off until this year. So right now is still not the time to attend those put off COVID weddings, even as a fully vaccinated person, because we want to be able to minimize the likelihood of spread of COVID-19 among infected people, particularly since there's some evidence that variants are more resistant to the current vaccines. So we're trying to hedge our bets, and these recommendations come from the CDC, the Centers for Disease Control and Prevention, and they're all with the idea of erring on the side of safety for all folks.
Okay, thank you. So Sarah, so we just talked about the spring break, but there are other spring holidays that are almost upon us. There's Easter, there's Passover. They'll be here soon. So how can people navigate them if some members of the family are vaccinated and others are not?
Yeah, I mean, I think, because the rollout of the vaccine has been so variable from state to state, it started out slowly. It looks like we're finally kind of picking up, but I think it is probable that we'll be some people who will be vaccinated and some who aren't during the holidays. And so certainly the best thing is to forego this holiday with family. But it's very difficult because people are just so over COVID, right? They want to get on with things, they want to be normal again. And the more people are vaccinated, the harder it is to tell people to continue to stay away from other people they haven't seen much, except maybe over a Zoom call in the last year. So what do we do? I mean, I think as Krys said, and I just want to reiterate that CDC guidelines say that people who are fully vaccinated can be with other fully vaccinated people, or with unvaccinated people from the same household who are at low risk. But you know, those who are seeing family who are not in your household, who are at increased risk of COVID-19 and are not vaccinated, you should really stay, if you can, not have that holiday, or if you do get together, to continue to wear that mask and physically distance from them. So, you know, based on that, then what do we do? I mean, I think unless everyone is vaccinated, you should continue to do what we've been doing in the past year. So take precautions. And if you do get together at the holidays, try and do so outdoors. You know, that would be the best thing, and try to maintain that distance from people. We're so close to kind of be potentially at the finish line, and we don't want to slow down and go backwards now. And if you have family that push back, what I would say is just remind them of how important it is to continue to protect those in your family who are at high risk of getting severe symptoms, and trying to remind them of how important it is to get vaccinated as soon as they can, so that at the next holiday, maybe the 4th of July, like President Biden is talking about, we can be together finally, and be more normal.
Okay, well, thanks for joining us today, and I hope you view some of our other videos and find links to reliable sources of information in our website, cph.temple.edu/coronavirus. Thanks for joining us.